surgery at the David Geffen School of Medicine at UCLA.
So what was your reaction to her announcement?
Not at all surprised. Many of us knew that she was going to do this or assumed she was going to do this because her risk of ovarian cancer is so high.
And it's because she had that genetic mutation, the BRCA
Correct.
gene.
Because she had the BRCA1 mutation, that confers usually about a 50% risk of developing ovarian cancer.
So talk about this procedure. It is an outpatient procedure. She goes in. She said the mastectomy was a more difficult one.
Yes.
But it does have some ramifications to it.
Sure. Removal of the ovaries and tubes is usually an outpatient procedure and can be done with what we call laparoscopy, so very small incisions, and it's a relatively short recovery. However, when you take a young woman who is still having menstrual periods, still producing estrogen, and remove the ovaries, that essentially puts her into instant menopause.
Right.
Unlike the natural process where it's gradual, this is an abrupt change. So she talked about preparing herself, she talked about using hormone therapy. Quality of life, young women who have their ovaries removed really do have quality of life problems. And so it's not the surgery itself, it's all of the other issues.
And you also bring up a fact that she's not home free, that removing the ovaries does not prevent you completely from getting ovarian cancer. There's still a chance?
There's a very small chance. It's probably less than 5%. But similar to when we do a mastectomy, you can still develop breast cancer about 1 to 3% of the time. So her risk is significantly reduced. She goes from about 50% down to about 5% or less.
One thing she did say was knowledge is power, and
Yes.
here we are. We're all talking about this, so
Right.
that's one thing that came out of it. We're all getting more educated on what to do here. Are there other options? Did she have other options other than going with this ovarian procedure?
Sure. One option that we sometimes recommend for young women is birth control pills, because that can suppress the ovaries and reduce the risk of ovarian cancer, but you can't stay on the birth control pills forever. And the problem is with ovarian cancer, first of all, the risk increases significantly after about age 45 to 50. So if we are talking about removal of the ovaries, we usually recommend until they're closer to natural menopause. But that's really the only option. The problem is ovarian cancer is difficult to detect early, and it can be very aggressive.
And the long-term treatment for the early menopause, like what does she face now?
Well,
Wow.
at least in her
It's not fun, Bob.
I can't speak personally.
at least in her letter to the Times, she talked about how she's using low-dose estrogen therapy and progesterone. So that will maintain a relatively normal hormone balance for her for a while.
She got the test done to find out if she had this gene because of her past history, but
Correct.
a lot of women can't afford to get that test. It's about $3,000. A lot of times it's not covered on insurance.
Right.
You know, if you look at your past and you say, well, gosh, my mom, my aunt, had the same cancer, what should these women do? Just regular visits
Well, first
to the
of all,
doctor?
it's not everyone with a family history of breast cancer. Usually it's breast cancer at a young age, or breast and ovarian cancer in the same family. And then really it's going to talk to your physician, potentially talk to a genetic counselor, because they can sometimes work with insurance. If you meet certain criteria, in other words, family history at a young age, then oftentimes the testing can be covered. In the absence of the ability to get tested, then close surveillance is very important.
Well, we definitely are learning a lot about this due to what she said.
Yeah.
So thank you so much, Dr. Deanna Attai.
My pleasure.
Appreciate
Thank
it.
you.
So many actresses were talking about their plastic surgery they're getting, right?
Yeah,
Trying
right.
to figure out what